In this lecture, we'll look at prescription of exercise and we'll look at general guidelines for improving fitness. One of the main emphases of this chapter is to take a person who's perhaps less active than they should be and to prescribe physical activity for them to increase their physical fitness. Before we get into this, though, let's talk about a few terms just to make sure they're 100% clear. So physical activity is any form of muscular activity. It could be done during exercise. It could be done at work. This physical activity can reduce the risk of death for all causes. Physical inactivity is a primary risk factor for coronary heart disease. Physical fitness is a set of attributes that relate to the ability to perform physical activity. And so one of the goals, as I said, of this chapter is to look at how we can improve physical fitness. And with that, we often get a reduction in some of the risk factors for diseases like coronary heart disease. And then finally, exercise is a subset of physical activity that's planned with a goal of improving or maintaining physical fitness. One of the themes of this chapter is that there are substantial health benefits of moderate exercise. These benefits include reduced risk for high cholesterol, increased clot dissolving activity, reduction in low-grade systemic inflammation. For this reason, the American College of Sports Medicine, or ACSM, recommends increased participation in low-risk, moderate-intensity physical activity. And again, of course, more vigorous activity we'll talk about also in this chapter, but for a lot of people, particularly people that are a little bit inactive or sedentary, there are great benefits to moderate level intensity exercises, and there's less risk of say, injury with these moderate intensity physical activities. Here are the take-home messages. Physical inactivity has been classified as a primary risk factor for coronary heart disease, and it's actually on par with things like smoking. It's pretty bad. So people who are physically inactive have a huge jump in their better outcomes in terms of health and fitness when they do move from physical activity to being at least a little bit active. Regular participation in physical activity can reduce the overall risk for those who smoke or who are hypertensive. Those who increase their physical activity and or cardiorespiratory fitness have a lower death rate from all causes compared to those who remain sedentary. However, there is a need to follow a variety of guidelines in prescribing strenuous exercise. Just as a doctor has to prescribe the correct dosage of a drug, when prescribing exercise to an individual, we have to correctly identify the dose that would work best. And this dosage, of course, is going to be calibrated by the health or fitness goals of the individual, as well as their current level of fitness. Let's look at an example from medicine to see what I mean by drug dosage. So depending on the potency, the drug must be administered at different dosages. So kind of an extreme example is botulinum toxin or Botox. This can be injected into the skeletal muscles of the face, and this causes a kind of flaccid paralysis, which leads to the muscles not contracting. So there's less tonus or less muscle tone, and this leads to a smoothing out of the skin. However, a high level of botulinum toxin can actually lead to paralysis of the respiratory muscles, the diaphragm in particular, and that would lead to death. So there's kind of an extreme example. You have to get the dose right. Now, let's think about the same thing for exercise. For an individual, perhaps they want to have certain health outcomes. Well, they could achieve that perhaps by walking 4 miles per day or something like that. And that would be just maybe as effective for their health goals as running 2 miles. Now, for someone who wants to increase their fitness, well, maybe the running 2 miles would be better because that pushes the body. It's more strenuous and so forth. So really, we have to figure out what the health goal and fitness goals of the person are. We have to take into account their current level of fitness, if they have any underlying conditions such as cardiovascular disease, and then figure out what the appropriate dosage would be. The response of the body to a given dosage of drug or a given dosage of exercise typically has a sigmoidal curve. It's called sigmoidal because it's roughly S-shaped. See, this sort of looks like an S. And so let's imagine we're talking about exercise. So perhaps you have a person, and you if you have them, and they're quite a fit person, and they're just doing very light exercise, like just very slow walking. Well, there's not going to be much of an effect for that person. As you go up in intensity to, say, brisk walking, to jogging, to running fast, and so forth, then there's going to be a greater and greater effect on either health outcomes or level of fitness. And they'll see that of obviously progressing as they do this exercise over and over again over the course of weeks. Eventually, however, there is going to be sort of a ceiling effect once you get to a very high dosage. When they're, say, doing fairly vigorous exercise, certain number of times a week, well, at some point they sort of max out. They get to the point where they're not going to be able to run, say, a mile any faster than they were a week before, because they'll hit sort of a ceiling. And so this is essentially, again, the sigmoidal curve. But one of the most important things to note about the sigmoidal curve is that when you prescribe medicine, is that you may want to try and be in the sort of the middle of this curve. Obviously, a low dosage of exercise isn't much. Maxing out the exercise dosage may be too much. It may leads you're not getting a lot of effect in terms of increased health outcomes, better health outcomes, or better fitness, but you're perhaps increasing the risk of injury and so forth. But right sort of in the middle range, you'll see that it's very interesting. As you increase the dosage of exercise a little bit, you get a large effect in terms of the response of the body. And so that's kind of an important concept. You want to be sort of in that range where you're really getting a lot of essentially bang for the buck. You're getting a lot of changes in terms of this person's response of the body. As I mentioned previously, one of the factors when you look at this sigmoidal dose response curve is that at the very highest levels of dosage of either a drug or exercise, you often reach sort of a maximal effect. So an example of this would be aspirin. It's very effective with mild to moderate pain, but once you get to really extreme pain, it's not as effective. And so it has sort of a ceiling effect. It has a maximal effect. Now, if you apply this same idea to exercise, we find often with athletes, and I'll take the example of female distance runners, at some point as they're exercising a lot, there may be an energy imbalance. They're using up a lot of energy, and if they're not bringing enough calories in, then you can actually lead to the point where they max out in terms of their ability to run. They're not running any faster. And yet you can actually push them to such a point where they have conditions such as amenorrhea, meaning that they lack their menstrual cycle. They stop having a menstrual cycle. So this is sort of just a warning, which is that you can push athletes to the point where they're at this ceiling, right? They've hit the top of this curve, and there really isn't going to be any improvements with dosage. Another thing to keep in mind when prescribing a dosage of exercise is there's considerable variability between different individuals. So for example, if you look at a graph like this, for a given dosage of exercise, there'll be a variability in the effect size for the individual. So for example, let's say we take a group of individuals and measure their VO2 max, and then we put them all on the same endurance training program. So they're all doing exactly the same exercise, the same number of times per week, and so forth. Well, we're going to see considerable variation in the gains in their VO2 max. So given a certain dosage, like let's consider this the exercise program, we'll have some individuals that don't have as much of an increase. They're going to increase in terms of their VO2 max, but it won't be as great as other individuals. And I should note, so that's for the vertical bars. I should note that the horizontal bars show that there's variability in the dose needed to achieve a specific effect. So let's say you wanted to have this effect size, right? So this displacement on the y-axis. Well, for some individuals, you might need a larger dose. For other individuals, a smaller dose. So that explains this horizontal error bar. When we prescribe exercise, we need to take into account the possibility of side effects. Let's take an example from the drug world. So ibuprofen is a very good drug for pain relief. But however, it's been shown with people that do vigorous long distance running, such as ultramarathons, that they double their risk of acute kidney injury when they take ibuprofen while running. So this is a very serious adverse side effect. Similarly, when we look at exercise, as we increase the dosage of exercise, typically we increase the risk of injury. So this is something to keep in mind. We may have to, depending on the individual, we have to think about potentially different types of exercise to lower the risk of injury or side effect. I've used the term dosage with respect to exercise without really properly defining it. Dose can be characterized by the FITT principle. F stands for frequency, the number of days per week or times per day that the exercise is done. I stands for intensity. This can be quantified in different ways. One is percent VO2 max. That's sort of the gold standard. Another way that's because heart rate is linearly related to the work rate and VO2 max, we can also look at percentage of maximal heart rate. That's another good way of identifying the intensity of an exercise. Another way that's actually quite good is the rating of perceived exertion. Recall that we talked about the Borg rating of perceived exertion, or RPE. This is a way of measuring subjectively the physical activity intensity level. So for example, on the scale that goes from 6 to 20, a rating of 6 is perceived as no exertion at all, like if you're just sitting around not doing anything, whereas 20 corresponds to maximal exertion or effort. And so basically, it's been agreed upon by applying this test many times and looking at people's heart rate and so forth, that a rating on this scale from 12 to 14 would suggest the person's doing moderate level intensity exercises. Finally, there's also a lactate threshold, which we've talked about. So at some point during aerobic exercise, there is a buildup of lactate. And typically the lactate threshold will be about 8 times hot. It will take for example, the normal concentration of lactate in the blood. When we reach a level that's 8 times higher than that normal level, we'll consider that to be, a really tremendous increase in lactate. And so the person would have reached that lactate threshold. And so when people do have a lot of lactate in their blood, that suggests they're doing anaerobic metabolism. And that, again, would suggest they're doing a fairly intense level of exercise. Another thing, of course, is time. So that's the first T. That stands for the number of minutes of exercise. Typically, this is expressed as minutes of exercise, say, per week, that sort of thing, if we're trying to look at this whole thing as a dosage. And then finally, we have the final T, which is the type of exercise. So it could be a resistance exercise with weights. It could be cardiovascular endurance exercise. And we can also break down, say, cardiovascular endurance exercise into specific types like swimming, running, and rowing. Another term that comes up a lot is the idea of a volume of exercise. So we can calculate the volume of exercise by multiplying the frequency, which would be, say, the number of times a week, by the intensity, and then multiply that by the time spent for each bout of exercise. And this gives you essentially the volume of exercise. So again, it's usually expressed as a certain amount of exercise per week. And why is this important? Well, we know that the volume of exercise is directly related to health benefits. That is, the greater the volume, the greater the health benefits. Another term that's very important is this idea of a progression of exercise. This is the transition of an individual from easier to harder exercise over the course of a training program. And there are, of course, guidelines for this progression depending on the person's baseline health state, whether they have coronary heart disease or they have metabolic disease or anything like that. The American College of Sports Medicine, or ACSM, has incorporated all the variables we just talked about into one acronym, which is FITT-VP. So this includes frequency, intensity, time, type, volume, which is, as we just discussed, the product of frequency, intensity, and time, and we'll talk more about that subsequently, and also progression, the idea that We always want to transition from easier to harder exercise. Again, we'll come back to that idea later. Finally, we also want to look at the response of an individual to exercise in order to track their changes. So one way of doing this is to look at the VO2 max value. So for example, if someone is doing relatively moderate to high intensity exercises, they should see an increase in VO2 max over time. And so that's sort of, again, the gold standard. Actually measuring VO2 max is quite good. And we'll talk about other ways of estimating what VO2 max is and how it may change. Another way of looking at it, of course, is to look at health-related goals. So for example, perhaps the person's really most interested in changes in cholesterol levels or their heart rate or something like that, their resting heart rate. Those are actually very good goals to try and achieve, and that can be measured quite easily also. So our take-home messages are: an exercise dose reflects the interaction between frequency, intensity, and duration, and this yields the total volume or dose of exercise. The response to an exercise intervention can include both functional changes, such as an increase in VO2 max, that would indicate an increase in fitness. And it can also include health outcomes, such as lower blood pressure, lower resting heart rate, and so forth. And these actually may change together. That's definitely possible. Like typically, as a person increases their VO2 max, you may expect to see certain changes, but they can actually potentially be a little bit independent of each other. In other words, a certain dosage of exercise, sort of light to moderate exercise, may lead to the desired health outcomes, such as lower blood pressure, lower resting heart rate, without really much of a change in VO2 max. Okay, so it is possible for these things to be somewhat independent of each other also. In response to essentially alarmingly high levels of inactivity in the American populace, the American College of Sports Medicine, together with the Center for Disease Control, issued a recommendation in 1995 that every U.S. adult should accumulate 30 minutes or more of moderate intensity exercise, physical activity, on most and preferably all days of the week. And by moderate intensity of exercise, they define that as 3 to 6 METs. Recall that a MET is a metabolic equivalent of task. A MET of 1 is just sitting, not doing anything. It's a resting level of metabolic activity. So we're talking about 3 to 6 times resting level of metabolic activity. Now, in 2007, the American College of Sports Medicine and the American Heart Association jointly put out a recommendation. They said to promote and maintain health, all healthy adults aged 18 to 65 years need moderate intensity aerobic endurance physical activity for a minimum of 30 minutes on 5 days each week, or vigorous intensity aerobic physical activity for a minimum of 20 minutes on each of 3 days each week. Finally, they actually included resistance training, which hadn't been included previously. So they said you should do 8 to 10 exercises, meaning that you're exercising different major muscle groups in the body. Each one is a different set of muscles. And you should do a minimum of 1 set, and each set would consist of 8 to 12 repetitions of a particular exercise. And this should be done on 2 or more non-consecutive days per week. Now, just another note on finding the proper dosage for exercise. It really depends a little bit on the goals. For example, if an individual has a health-related goal, such as reducing resting blood pressure, the prescribed exercise intensity may be lower than that required to achieve an increase in, say, VO2 max. One thing to keep in mind with people when they're exercising is that different physiological variables respond at different rates to exercise. So for example, there may be an acute response. This will occur within 1 or several exercise bouts. And it may not improve further, although of course it's possible certain things may increase further. So certain things that do respond very quickly would be, for example, the sympathetic nervous system, blood lactate response to exercise, and the heart rate will adapt relatively rapidly to exercise training. In other words, the first time someone who's completely sedentary starts to do exercise, their heart rate may go up very rapidly to a very high level. just after a few exercise bouts, this may not, their heart rate may not change quite so dramatically. And again, that's related to the sympathetic nervous system. So the body is essentially compensating already for the idea that it's getting better at doing exercise. Often these rapid responses occur very early, and they do have a tendency to plateau. Other things may, certain physiological variables may have more of a linear response in which you have gains that are continuously made over time. So for example, we know that athletes have a lower resting heart rate. Essentially, they have often a bigger stroke volume and so forth. So that kind of gain doesn't happen overnight. It takes a lot of time and training, but you would expect a fairly linear change over time. And then there are some physiological variables that may not show any response whatsoever in the initial weeks of training, but over time they will actually you'll start to see improvements. So these are just things to keep in mind, that not everything will change at the same rate. Some things are notoriously slow to change, where other things change relatively rapidly. So we've talked a bit about the dose-response relationship to exercise. Here's a really good illustration of some of the things we were talking about. Let's say the person is doing moderate intensity exercise, which would be 60 to 70% of the person's maximal work capacity. That's very similar to, say, 60 to 70% of VO2 max. Now, if we look at the green curve here, we can see that the insulin sensitivity and blood pressure, they're both combined in that one curve, show the most change. So with, let's say, 90 minutes of exercise per week, there's a large change in insulin sensitivity, which is a good thing. They're getting better. This would lead to a better handling of blood glucose after a meal. And they're also seeing positive effects on blood pressure. So their blood pressure is decreasing. So this is just plotted with the maximal effect going positive. But the blood pressure would actually be decreasing, right? Their mean arterial pressure would decrease. So that's a good thing. These two particular variables are very responsive to exercise. And so they change quite rapidly. And you don't need a very high duration of amount of exercise. So 90 minutes is sufficient to get a very large effect size. Now let's look at the blue curve. The blue curve has two variables plotted together, heart rate and VO2 max. And again, we're just looking at the maximal effect of the exercise on this. So if we look at 90 minutes of exercise, we still get a fairly substantial effect. So the person's resting heart rate, presumably it's this resting heart rate, or it could be their heart rate during the exercise itself. Perhaps the heart rate doesn't increase quite as much during the exercise, which is a sign that the person is becoming more fit, and perhaps their basal resting heart rate is now a little bit lower. In either case, there's a pretty good heart rate response, and we're actually seeing that the person is getting more fit because their VO2 max is increasing. But what you can see here is the blue curve is below the green curve. So for a given amount of exercise, a duration per minute at this particular intensity, which is 60 to 7% of maximal work capacity, we're not getting as big of an effect. And so these things are just taking more effort, essentially, would take more effort in terms of a longer duration of exercise to reach the same effect size. Alternatively, perhaps you just have to continue the exercise for a longer period of time. Eventually, you might get there. Period of time in terms of number of weeks of the training program. Finally, we have the red curve. Here we see given a certain dosage of the exercise, so again, it was 90 minutes, which was really quite effective with insulin sensitivity, quite effective with heart rate and VO2 max. There's actually very little change in the lipids in the blood. So if this person's goal was to increase high density lipoprotein concentration, well, this is not that effective. They would need to move to a much higher duration. So if they move to, say, 210 minutes of exercise per week, then they're going to get a pretty significant boost in the effect. And so again, this is something to keep in mind, that depending on the health goals or the fitness goals of the individual, we may have to prescribe different durations of exercise. As we talk about dosage of exercise, I want to point out a few things. This is a slide I showed earlier, but what I've done here is I've added essentially the recommendation in terms of the duration. So, for example, we saw that in this 1995 recommendation, that they were saying an adult should do 30 minutes or more of moderate intensity exercise on most days. So moderate intensity was something like a brisk walk or a jog. And this should be, most days would be, of course, 7 days a week. So you could do 30 multiplied by 7 would be 210 minutes per week. Now, in the 2007 one, they said, okay, moderate intensity aerobic exercise, minimum of 30 minutes on 5 days a week. So you could, so that of course is 150 minutes. So that's similar. I mean, because here they're saying, most days to a full week. So we're talking about basically about 150 minutes to 210 of moderate intensity exercise. Now, what I want to contrast that with is vigorous intensity exercise. In the 2007 recommendation, the other possibility is you do vigorous intensity aerobic physical activity for a minimum of 20 minutes on a minimum of 3 days a week. So that would be a total of 60 minutes per week. So you can see there's quite a big difference, right? Depending on whether someone's doing moderate intensity exercises versus vigorous intensity exercises. I just wanted to point that out because we're going to talk a little bit more about why you're able to get away with essentially much less time if you're doing vigorous intensity exercise. Another point that I should have made earlier was that in the recommendations is that they often said that you could do exercise bouts as short as 10 minutes. So in other words, imagine this individual is trying to do their 30 minutes a day. Well, they could do 3 bouts of exercise, each being 10 minutes long, and the recommendation states that that should still essentially account for or add up to the 30 minutes per day that they need. Okay, yet a more modern guide is the U.S. Physical Activity Guideline, which was published in 2008. Keep in mind that as they keep refining these guides, they essentially are using scientific data to do these. So they're based on better and better data about what's really recommended, what's needed for the individuals. So individuals can realize the health-related benefits of physical activity by doing between 150 and 300 minutes of moderate intensity physical exercise per week. Or they may do 75 to 150 minutes of vigorous intensity physical exercise per week, or some combination of the two. Again, I want to point out here that the difference, let's take the minimum amount. So if you're doing moderate level intensity exercise, which would be something like a brisk walk, you would want to do 150 minutes per week to get the health benefits. Whereas if you do much more vigorous intensity exercise, like running at a fairly high fast clip, you would only have to do 75 minutes. So the basic, it's a ratio of about 2 to 1. So if you're doing moderate intensity exercise, you'll get the same health benefits, but you need to do twice as much in terms of duration. So that's the main point here, is that there's the difference in timing or duration. And of course, with these newer guidelines, they're saying that you can always do more, and that's beneficial, and that's going to be more is better. That's good. And again, this guideline reiterated the same idea that had been in earlier guidelines, which is that most people can't fit all this in one big exercise session per day. So you could break it up into smaller bouts. So, and the minimum bout length is 10 minutes. So a walk in the morning, another one in the afternoon, one in the evening, that sort of thing would certainly help someone to meet, say, 30 minutes per day. So I want to next address this idea of why you have to do 150 minutes per week of moderate intensity exercise versus 75 minutes of vigorous intensity exercise. Basically, the idea comes down to this idea of volume of exercise, which we talked about earlier. So health-related gains are realized at a volume of physical activity of about 500 to 1,000 MET minutes per week. So we're essentially multiplying the intensity of the work, which is expressed in METs, by the duration, or the amount of time spent per week doing the exercise. So for example, walking at 3 miles per hour requires about 3.3 METs. If a person walks for 30 minutes, 5 days a week, then the volume of physical activity is 495 minutes per week. And the total time is 150 minutes, right? So if a person jogs at 5 miles per hour, that's an intensity of 8 METs. Let's say they do it for 25 minutes for 3 days a week. The total volume of physical activity is 600 minutes per week. So it's higher than the 495 we got by walking. And the total time spent is half. It's 75 minutes. So this means that essentially, if you're jogging, you're going to get a higher volume of exercise done per week, and you're going to meet that minimum required threshold to get the benefits, the health benefits. And so this explains why it's recommended that people do at least 150 minutes for walking versus 75 for running. Here we have some information about why everyone should be engaging in more physical activity. Physical activity is associated with lower rates of all causes of mortality, total cardiovascular disease, coronary heart disease incidence and mortality. It's associated with increased weight loss and reduced weight regain, lower incidence of obesity, type 2 diabetes, and metabolic syndrome. So metabolic syndrome refers to things like diabetes. Reduced risk of colon and breast cancer, improved ability to complete activities of daily living, reduced risk of falls, reduction of depression and cognitive decline, and favorable changes in cardiovascular disease risk factors. So basically, the take-home messages of that is that physical activity and health is very good for your health. And as we discussed, the volume of physical activity is actually the most important variable that's linked to health. The risk for chronic disease is reduced by 20 to 40%. And the interesting thing is, for people that are really sedentary, that don't do any exercise, the greatest gains go to those who go from no activity whatsoever to some activities. So even just, a walk around the park, that will help them tremendously in terms of health goals. So again, some physical activity is better than none. And so for some of these individuals, you don't even have to, obviously we can give them the recommendations so they can try and meet those. But if they don't meet them, they're still going part of the way towards the goal, and that's always helpful. Now, in general, the rule is more activity is better for health outcomes, as we saw in the earlier recommendations. But there is a balancing act here, where if we don't want to increase the risk for adverse outcomes, which may occur with too much activity. So again, for certain people, perhaps the most vigorous activity and for a long duration wouldn't be recommended because there'd be an increased risk of injury. An ongoing debate is whether vigorous exercise is better than moderate exercise. It turns out that vigorous intensity in physical activity is associated with a reduced risk of coronary heart disease, or CHD, compared to lower intensity exercise. Additionally, vigorous intensity physical activity was more beneficial for lowering coronary heart disease risk factors. It lowers the diastolic blood pressure, it improves cardiorespiratory fitness, and it improves glucose control. However, if you look at other variables, it's no better at lowering systolic blood pressure or improving the blood lipid profile or in causing a loss in body fat. Higher intensity physical activity is associated with greater impact on coronary heart disease risk factors, so that's a good thing, and also results in less sick leave. So it does appear that moderate intensity physical activity or exercise is better than, vigorous intensity physical activity is better than moderate intensity physical activity. But the one thing to think about, though, is that for certain individuals, what most people would consider, or healthy people would consider, moderate intensity physical activity, which is 3 to 6 METs, may actually be vigorous for people that are deconditioned, as your book puts it, which are people that are out of shape and sedentary. So, and the other thing to think about is the fact that for certain people, the vigorous intensity physical activity may be too much, at least initially when they start an exercise program. Moderate intensity physical activity is defined as being from 3 to 5.9 METs. Vigorous exercise is defined as equal to or greater than 6.0 METs. And another way of looking at or defining vigorous activity or exercise is that it's equal to or greater than 60% of VO2 max. So let's take a look at this graph here. We can see here that, let's take the example of someone who has, on the x-axis, we have exercise capacity. So we have people with different levels of exercise capacity. So let's take an individual who has an exercise capacity of 8 METs, meaning that that's the highest metabolic activity they can have, which is, in other words, 8 times higher than their resting level. So for this person, if they're on a treadmill walking at 3 miles per hour, well, they're at 41% of VO2 max, so they're still within the moderate range. Now, by the time, if they're doing 4 miles per hour, though, they're already at 63%, which is obviously greater than 60%. So this would actually be vigorous exercise for this particular individual. So, and we can look at other individuals here and see how they would fare. But the point is that depending on the individual, what may be moderate exercise for some people will actually be vigorous exercise, and that has to be taken into account when coming up with an exercise prescription. The take-home messages are: to achieve health-related benefits of physical activity, adults should do between 150 and 300 minutes of moderate intensity physical activity per week, or 75 to 150 minutes of vigorous intensity physical activity per week, or some combination of the two. And additionally, the newest guidelines state that resistance training should be part of this fitness program. So people should do 8 to 10 exercises, meaning that they're doing 8 to 10 different major muscle groups, and they should do one set at a minimum. And within each set, they should do 8 to 12 repetitions of a particular exercise. Now, you could, of course, do more, but this is the minimum to maintain muscle strength and so forth. And this should be done on 2 or more non-consecutive days per week. As I previously stated, the benefits of moderate physical activity is that there's a reduction in health-related problems. And with moderate intensity exercise, the risk associated with the physical activity is very low. Now, things change a little bit. If we're talking about vigorous activity, there is, in fact, a risk of cardiac arrest. And this risk is higher during the exercise than when the person isn't exercising. Now, having said that, this shouldn't dissuade people from doing exercise or even vigorous exercise, because associated with vigorous exercise is a lower overall risk. So if you average over the time when the person is exercising and when they're at risk overall, they'll have a lower risk of cardiac arrest compared to sedentary men. And we can look at a little bit of why this would be by looking at this graph here. So we have divided a group of men up into quintiles, meaning they're fifths. And we have people that have the lowest exercise capacity, indicated here by the number 1, and we have the highest quintile. This is the people that are the most fit within this group. Furthermore, we have normal subjects, so they have no underlying diseases or anything, and then we have subjects with cardiovascular disease, which are shown in the blue with the blue bars. And then what we're plotting on the y-axis is the relative risk of death. So what you'll notice right away, if we look just at the normal people subjects, that as a person increases their exercise capacity, they have a lower relative risk of death. And so, of course, the best way to increase your exercise capacity is to do exercise. So moderate exercise or more vigorous exercise would be a good way of lowering your risk of death. And then the other thing that's quite interesting here is subjects with cardiovascular disease, shown with the blue line. And what you can see, what we're doing is we're doing the relative risk of death. So of course they're overall going to have a higher risk of death, but we're we're doing a relative number. So you see that everything's normalized to a value of 1. So that's for the people with the highest quintile. So if we say that's 1, you'll find that subjects with cardiovascular disease that are essentially sedentary or have very low exercise capacity, so probably are sedentary or don't exercise much, they have a relative risk of death that's 4 times higher. So this means within the group of people that have cardiovascular disease, it's still much better to have higher exercise capacity. And again, that implies that these people are probably doing more exercise than the people that aren't. And finally, the other thing that's really interesting is that this isn't perfectly linear. So if you look at the normal subjects, as they move, let's say we have an individual who's in the bottom quintile at 1, and they start to do, say, a moderate physical activity exercise program, and now they move to, say, the second quintile. Well, they've had a tremendous drop in their risk of death. And so just being somewhat physically active is much better than being essentially probably completely sedentary, which are these people over here in the first quintile. And then as they progress, if you were to the same individual were to be able to increase his or her exercise capacity, these are men actually, so as he's able to increase his exercise capacity, there'd be further improvements. What we found is that in previously sedentary subjects, small changes in physical activity result in large health benefits. Strenuous exercise increases the risk of heart attack during the activity, but reduces the overall rest plus exercise risk of an event. Moderate to high levels of cardiorespiratory fitness confers additional health benefits and increases one's ability to engage in recreational activities. When prescribing exercise to a person, the very first step is screening. In this screening step, an evaluation of the cardiorespiratory function, or CRF, of the person needs to be done. As we discussed at length previously, there needs to be health screening to decide if the subject may begin an exercise program immediately, or if the subject should consult with a medical professional. Another major point is that, and this is made by the U.S. Physical Activity Guideline, which is to use a progression when introducing someone to physical activity, or when an individual who's already quite physically active doing moderate intensity exercises moves to vigorous intensity activity. So that's a general idea. The progression should be built into the training program. Additionally, though, within an actual exercise bout, the idea of progression also applies there. So, for example, an individual should always transition from light to moderate exercise initially to more vigorous intensity exercises. So, for example, during a single exercise bout, you'd start with a walk and then move to a jog or potentially a jog run. And the other thing to think about is the progression in terms of not only the intensity, but also the duration. So, for example, you could increase the duration of exercise by about 10% per week. So if a person is doing 100 minutes of exercise per week, they could add about 10 minutes per week, and that would be a very safe way to do this. And one thing to keep in mind too is the rate of progression should be different for different individuals. So for older, less fit individuals, you would have a slower progression or increase in either the intensity or duration of the exercise over time than you would for younger, more fit individuals. Finally, important component of any exercise prescription would be a warm-up, stretch, and then a cool down, and potentially a stretch afterwards also. So before any sort of dynamic exercise, there should be stretches to increase the range of motion of joints and to, of course, increase flexibility of the lower back and so forth. And then during the exercise, or I should say right after the exercise, there should be a minimum of about a 5-minute cool down activity. This could be, for example, slow walking or stretching exercises. And this is very important because it reduces the chance of hypotension after an exercise session. We talked previously about, I talked about the dangers of hypotension. So for example, if someone's running and it's very hot and humid, there may be a lot of blood flow to the skin as they're trying to offload the heat. Now, if you immediately were to stop running, say at the end of a race, and you didn't do any sort of cool down, then there's still going to be a lot of blood flow through the blood vessels going to the skin, but the heart rate and heart contractility would go down. So you'd have a lower cardiac output immediately after the exercise, because that would sort of adjust to the fact that the person's no longer running, but there'd still be a lot of blood flow to the skin. And this could potentially lead to hypotension, so the mean arterial pressure would decrease. Recall that mean arterial pressure is equal to the cardiac output multiplied by the total peripheral resistance, which is also called the total vascular resistance. And so again, if there's a lot of blood flow to the skin, there'd be a low total vascular resistance. If the cardiac output drops, then the mean arterial pressure will drop, and that could potentially be very dangerous. And so again, a cool down period is really critical, especially in hot, humid conditions.